You're listening to the Science of CX. My name is Steve Pappas. I'm known for my relentless pursuit of all things customer. Across my career, and also in my 6 startups, I've had to learn how to make decisions in business that customers really respond to. Let's spend some time together and help your business soar, grow, and accelerate. Hello and welcome back to the Science of CX podcast. My name is Steve Pappas, and I'll be your host. Today we have a different podcast in our series of healthcare providers that we're talking to. And today we'll be welcoming Dr. Brett Ashenfelter to our show. Welcome, Brett.
Hi, thank you.
Brett, can you tell our audience a little bit about you and about your practice?
Absolutely. My name's Dr. Brett Ashenfelter. I'm a doctor of physical therapy, and I have a physical therapy practice called Oak Physical Therapy in Amherst, New Hampshire.
Great. So thanks for joining us today. And what we'd like to do is we'd like to talk about what's been happening in your world from your perspective as a practitioner and how things are changing. We're really looking about the change and how patients have been responding to things and how you're dealing with it. So maybe what we could start off with is, in your world, after all of the changes that have been happening all around us, what is your new normal looking like today?
Well, I have to tell you, Steve, it's all over the place. I'm seeing a lot of patients online. It's especially tricky in my case because I sort of based my practice around the idea of doing lots of manual therapy. So meaning hands on the patients. And obviously that's not a possibility anymore. So it's looked a lot more like trying to find some of the virtual tools that I can monitor patients with, trying to figure out some low-tech solutions for figuring out if patients are doing their exercises properly. Things like putting a grid behind the patient or putting it over the image of the patient afterwards to see exactly where their points are lining up so that I can see if their posture is correct. Just a lot of different things, and also changing my patient base. It's not necessarily the same people who wanted to come in for manual therapy looking for some of the telehealth services.
Interesting. So I would imagine that COVID-19, the coronavirus, has affected both your business and your patients.
Yes.
And so it's affected your business how?
Well, it's affected my business in that I was, going to the clinic every day and, seeing patients I would do 50 to 60 minute blocks for each patient, one-on-one. And now that's not a possibility to go into clinic and do that. So a lot of it is working from home, trying to maximize benefits. The other thing that's tricky about this is working with insurance and Medicare, because in the past, telehealth services have not necessarily been covered at all. So for physical therapy. So now it's a matter of trying to figure out some of those billing things. And one of the things that we found is that we have to limit patient appointments. Before it would be, that 50, 60 minutes. However, for the reimbursements now, a lot of times we can't get coverage that increases past that 21-minute point. That's what a lot of the billing codes dictate. And so it's a matter of deciding, okay, so are we going to go through insurance for an individual because it's supposed to be according to Medicare guidelines, as I understand them now, which is continuously evolving, we can do 21 minutes or a little bit over once every 7 days. So whereas I might have been seeing somebody for 50 to 60 minutes, possibly even 2-3 times a week, that's severely limited. However, there's also the option of offering some of the services as health and wellness services, which won't necessarily be covered through insurance. However, the health savings accounts that individuals have can still be used to cover these services. And then it's a matter of finding a price point that's comfortable for patients so that they can still get the care that they want and need, regardless of what their insurance reimbursements are going to be.
Okay, so I could see where there will be some changes in the financial models happening fairly quickly for you too. So you've switched to working from home to work with your patients now, or are you going still into the office?
So I would say I only go into the office maybe once or twice a week. I work a lot with, I see all types of patients, but I work a lot with perinatal care. So mothers while they're pregnant, and then after pregnancy, as well as infants. I do a lot of lactation support work. So I'm still going in for the infants about twice a week, because a lot of times when you have an infant who isn't nursing and latching properly, that's something critical that has to be addressed urgently. And so that's something that I will go in and see patients for. But beyond some of those urgent services like that, patients really don't want to come in either. So yeah, it's a lot more work from home.
So you mentioned earlier about the billing codes and insurance changing. Do you find other healthcare policies and procedures are changing on you rapidly, and how is that getting communicated, and how does it get enforced?
Yep. So the way that it's communicated is usually you get an email blast from the insurance companies that you're in network with. Medicare usually kind of sets the gold standard. So we first received the emails that Medicare was going to start reimbursing for telehealth visits. Then about a week or so later, we heard from Harvard Pilgrim that they were going to start covering, and then some of the other insurance companies fell in line with that. Now, as far as getting it reinforced or having it enforced, that still remains to be seen. What's going to happen is we're just going to have to look at what our reimbursements are over time, and we're going to see a lot less coverage, a lot less money coming in from an individual patient. And so the need to diversify our patient pool as well and serve more patients.
Interesting. So all of this must be affecting the patient's experience in general, because when they're used to coming in and getting that level of care that I know you give, um, how do you feel that the patient's experience has changed along the way too? I'm sure they're happy to get anything, but it must be affecting it somehow. Are you hearing that from them?
Yes, absolutely. So some of my patients, I truly was just doing a lot of manual therapy with. So they would come in and it would be a session of them, lying on the plinth or the mat, and me doing different manual procedures, soft tissue mobilization, joint mobilizations, things like that, where they just kind of hang out and lay back and I do a lot of the work. So since that can't happen now, um, there are certain patients who I was doing just that with, and it was sort of maintenance type work. And with them, they might want a few exercises, but basically they're being discharged for the time being. For other patients, like for example, I do some developmental milestone checks for infants, and I was really concerned that I wouldn't be able to do those at all because I wouldn't be able to put my hands on the infants and put them in different positions and things. However, maternal and paternal intuition is a great thing. And a lot of times these patients are coming to me now and we're having these online conferences, and they'll say, I have been concerned because it doesn't seem like my infant is doing this, this, and this. And so then I can have them demonstrate through holding the infant for me and positioning the infant. And I sort of see what's going on a lot better than I anticipated. And then from there, I can give guidelines, or if they don't have anything that they've observed, I can still have them put the infant in different positions and answer questions about which milestones they've witnessed. So it's just a much different, a lot more interviewing of the patients and parents than there used to be. I've also found that with a lot of the pelvic floor health, I was worried that because I couldn't do pelvic floor exams and things like that, that I wouldn't be able to help patients. However, with those, I found that I'd say probably about 70% of my patients have still been able to progress with pelvic health concerns, because a lot of that can be done through exercises without any internal monitoring at the time.
Interesting. Interesting. So maybe you could tell us a little bit about some of the tools or some of the things that you've sought out to shift to this telemedicine and telehealth approach. Are there specific things that you use that you find patients find easy to be up and running with? Because we've heard from other providers that the office is ready to deal with telehealth, but not necessarily a large segment of the patients are ready.
Right. And so the first thing that we had to figure out, obviously, was a HIPAA compliant service. So everybody loves to use, and now I've forgotten what we're talking on today. Zoom. Everybody loves to use Zoom, but obviously that's not HIPAA compliant and secure for our patients. So we had to trial a couple of different programs, and we wound up using an online service called DoxyMe. And with that, there's a waiting room. So our patients they're sent a link, they just check in, and then they sit in the waiting room. We receive a notification as soon as we're there, and we log on, and that works really well. However, initially when we were trying different programs, a lot of them, I suppose because they have to be secure and it takes a lot more resources to run those programs, we were having a lot of difficulty with the images cutting out, with the audio cutting out. So that was a little bit of a process. And then the other things that are a little bit difficult are things like there are a lot of remote wearable monitoring. There's a lot of medical devices that you can wear and monitor remotely. However, they cost a lot. And so it's a matter of either us acquiring them for the patient and then sending them out to the patient and then they return it, or it has to be a matter of each patient buying their own. So for example, one thing that I've been considering for my pelvic health patients is a PeriFit, which is an insertable device that it's sort of supposed to be like a video game for your pelvic floor where you contract and relax and it shows how much recruitment you're getting. So this is one of the tools that I'd like to use. However, it's, I believe, about $100 to invest in. And obviously we would need each patient to have his or her own. So things like that, it's difficult to know, are patients going to be willing to do this or not? I've found that with pelvic floor rehabilitation, a lot of times because the quality of life is suffering, people are willing to invest a little bit more. For example, I've already been using pelvic floor weights in the past, and those, the set I usually recommend is about $60, and that's no problem for most patients because the pelvic floor, they really are prioritizing. Whereas if I have a patient, for example, who has a hand or wrist or carpal tunnel syndrome, so some pathology with the hand wrist, they're not necessarily going to want to invest in, a dynamometer to measure grip strength and a lot of other equipments that could be monitored remotely. So for that, I need a lot more low-tech solutions that I can just sort of go online. They don't have to buy anything right off the bat, and we can use what's in their home to help them rehabilitate.
Do you see insurance companies stepping up and maybe changing their approach to reimbursing patients for some of these things if they're necessary during this period?
So yes, a lot of that has changed very rapidly. We don't usually see changes in our industry this rapidly, but there is a lot more reimbursement that should be happening for these services. However, like I said, it's very limited in how much time they're going to cover. And as far as like patient visits and the number of encounters that they're going to pay for, some of that remains to be seen. For example, if somebody came to me with an insurance policy in the past and they were approved for 20 visits, does that mean that they're still going to only be approved for 20 visits now that they're telehealth and they're shorter visits and less frequently? Or does that, are they changing the structure of those visits and the number that they reimburse for as well? And that remains to be seen. But we do have a lot of more billing codes to be able to code and then submit to insurance for reimbursements.
Well, the good news is I think we're seeing insurance companies are finding that they have to start addressing some of these things. I mean, telehealth has been on the books for over 10 years now, but it really hasn't been used until this crisis really came on us. So I guess maybe, if you had a crystal ball to look into, what would you say your practice might look like after COVID-19? Because some things may change, for the future too.
Yeah. Oh, absolutely. So I think that it's very hard for any of us to predict how long some of these isolation type measures are going to last, even once we're able to flatten the curve. And so really my mentality is that we are planning on a semi-permanent shift. And so I think that in the future, I'm going to have a lot more educationally oriented services. I'm going to be using a lot more technology, but different technology. Whereas I used to use TENS or eSTIM machines or different modalities in my clinic, now it's going to be a lot more remote patient monitoring technology, like the PeriFit that I mentioned. I also think that we're going to shift a lot towards out-of-pocket health and wellness services because those aren't subject to some of the insurance reimbursement restrictions that other care would be. And so if we label it health and wellness instead of physical therapy, we all of a sudden are able to do a lot more and speak with our patients more frequently, more often, and give them the higher quality care that they would like.
Interesting. Well, it sounds like you're definitely planning for the future, and you're planning for what changes might become, and what may be part of the landscape in the future too. Are there any other things that you think might change in the future?
Um, well, I think that, some clinics are still seeing more patients than we are currently as far as in-person visits. I really think that even those clinics, a lot of them are shifting away though now from that with this increased awareness. So I think that in the future, a lot of this is going to remain where people will be wanting telehealth visits, especially even if we had no worries about, infection or anything like that. I think a lot of my visits in the future might be, okay, so I see you in my clinic for an initial evaluation and maybe for the first or second appointment to get a few things squared away or when you need manual health. But then a lot of the check-ins, I think, will probably be done remotely because it's so much more convenient to do those from people's home and work if they don't feel like it's strictly necessary to come in.
Great. Right. Well, I know that you value patient experience very highly. What are the things, or how are you approaching making sure that you're keeping your patient experience as high as possible during this time?
So this one's going to probably be a hard one for some clinic managers and directors to swallow, but cutting way down on the patient load initially so that we can troubleshoot and figure out what is working and what isn't working. Not all of my patients, as I mentioned before, were candidates for using telehealth and telemedicine for what they needed. So the ones who have come with us, we really are just seeing those and not trying to attract a lot of people to the clinic yet through telemedicine because we're just having to troubleshoot and figure out, okay, so was this valuable? Did this help? Did you feel like it was significantly different or lacking as compared to the office visit? And really having a lot of those discussions off the clock with patients throughout the process and not trying to advertise and draw a lot more in until we have some of those policies and procedures well established.
Well, it sounds like you're approaching this very much from the patient's perspective, and here on the Science of CX, we always talk about how things affect the customer, in this case, your patient, and it's really encouraging to see how quickly and how thoroughly that your practice has moved to this new paradigm, if you will, and how everything is shifting for the benefit of your patients. Dr. Brett Ashenfelter, I want to thank you very much for joining us today on the Science of CX, and I wish you all the best and be safe for you and your family moving forward into the future.
Thank you so much for having me, Steve. You too. Take care.
You've been listening to the Science of CX. My name is Steve Pappas. I really hope you've enjoyed this episode. And if you have, the highest compliment that you can give us is to subscribe, rate, and review the Science of CX. Thanks, and we'll see you in the next episode.